For more on the situation in Russia, let's go to Moscow to speak to our correspondent Galina Polanskaya. Morning, Galina. It's clearly quite concerning, the numbers in Russia, particularly that high number of reported cases yesterday, over 10,000. What are authorities saying, and are the public concerned?
Good morning. While Moscow's mayor Sergei Sobyanin said that in reality 2% of capital's population is infected, which is 250,000 of cases, which is way too bigger than the total official number of cases. The real number is not known as far as I understand, and it is due to the lack of testing, first of all. So the virus spreads fast in the regions, and some people are frustrated and scared. Some told me that Moscow should have been closed totally a long time ago and that now it is too late. Another question, the number of deaths from coronavirus is in the air. You see, now officially Russia has only 1,280 deaths from coronavirus, but the head of Russia's Alliance of Doctors Trade Union, Anastasia Vasilyeva, said that authorities were referring to coronavirus as an ordinary pneumonia. And one chief of a Moscow hospital told me that Russia has a very weird history of interpreting numbers. So this question, how many are dead from COVID-19, is in the air here.
The thing people will have a close eye on, Galina, is the medical systems and whether they've got capacity to be able to deal with a rise in patients. How is Russia responding to that very sharp uptick in the cases that we saw over the weekend? Is there capacity in the health system for people who need care?
You see, Moscow is the best equipped, and Moscow hospitals are already at their capacity, and temporary hospitals are being established in sports complexes and shopping malls. Doctors from various regions are urging in their social media for help because they said that they lack protection supplies. They are asking NGOs for help, and the FSB, the Russian Federal Security Service, is checking those doctors, saying that they are spreading fake news. There is a shortage of staff, apparently, which is underpaid, according to some staff in Moscow's hospitals. And Russian health ministry and education ministry decided to send medical students to the hospitals, and it is a part of their educational practice, and those students are obliged to do this. They can say no only to working in red zones, but they say that this division into red and white zones is not the real one, and the risk to get sick there is very, very high, and nobody asks them if they live with some elderly people and if they have some chronic diseases. So I've spoken with a student, a medical student, and she told me that everyone is really frustrated because they risk not to pass their exams and to be actually kicked out of the universities.
Нам нужны гарантии.
We need guarantees. We need guarantees to get means of protection. Because we all hear news from our colleagues, from doctors, that there aren't enough means of protection, even for those who work. Where they're going to get them for students who go to dozens of hospitals is absolutely not clear.
The number of infected in Russia is really getting higher and higher with every day. And Russia now is on the 7th place of the most affected countries in the world.
Galina, thank you very much, our correspondent in Moscow.